National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm naturopathic Dr. Jonathan Beatty, a health expert here at nationalnutrition.ca. Endometriosis is an affliction that affects many of my patients, and so I want to share some information with you today that may help you manage your endometriosis or actually ideally prevent endometriosis if you happen to be at risk. So who's at risk for endometriosis? Well, it's a condition, it's not specifically hereditary, but if you do have a family member with it, you are 6 times more likely to develop it yourself. And there seems to be a sort of predisposition to it, but it's not something that you're necessarily definitely going to get just because, say, your mother, aunt, or sister has it, but you are at an increased risk of developing it. So what is endometriosis? Well, endometriosis is growth of uterine tissue in an area that's not your uterus. So these cells from the uterus are potentially traveling up the fallopian tube or into the ovary is the most common sites for this, and that can cause a lot of pain, extreme pain around your menstrual cycle. So if you have extremely bad, what we call PMS or premenstrual symptoms, you may actually have endometriosis, and you may want to get that checked out by your doctor. Now, diagnosis can be difficult on this one. In fact, it's a rather invasive procedure to have it diagnosed, either through what we call laparoscopy, where small incisions are made and a camera is inserted, which can then take a small biopsy, or you can get what they call a laparotomy, where it's actually a more major surgery. But regardless, a biopsy has to be taken in order to confirm that these endometrial cells or uterine cells are growing in tissues that's not the uterus. So that's truly what endometriosis is. Now, if you do have it or you're susceptible to having it, what can be done to either manage your symptoms or prevent the development of the condition? There's a lot of lifestyle factors that seem to be associated with it. So things you'll want to do are limit your coffee and caffeine intake, limit alcohol intake, and increase your vegetable intake. So those lifestyle changes seem to have an incredible effect both at managing and preventing the development of endometriosis. So if you do have it, consider increasing the vegetables in your diet. I always ask my patients, well, what vegetables did you have for breakfast today? I often get a blank stare at them. I go, what do you mean vegetables for breakfast? Try and at least incorporate 3 servings of vegetables into every meal. It's an easy way to help you reach 9 to 10 servings of vegetables a day, and a great way not just to alleviate endometriosis, but ultimately improve your overall health and prevent a large number of diseases. We just don't eat enough vegetables anymore, and that can be a very, very important health change that you can make. Now, if you do have endometriosis, all is not lost. In severe cases, it may require surgery, but I always look at surgery as sort of your last-ditch effort. When all else has failed, now we can go to something more major. It's not that I'm anti-surgery, but with surgery comes an inherent risk, and if we can do anything to avoid risks and try and manage things with the lowest risk, that's what I always like to do as a physician. So from that standpoint, I always try and handle endometriosis with safer interventions before we have to go to something like surgery. So what can you do? Well, there's a few supplements you'll want to look at. Selenium, which is very important in the management of hormones, especially involved in the interconversion of your hormones, can be very important for helping to reduce endometriosis. As well, you want to ensure adequate intake of essential fatty acids. One that can be particularly beneficial is gamma-linolenic acid, or GLA, often found in things like evening primrose oil or black currant oil, and that's been shown to help alleviate endometriosis. In addition to those, you can look at some anti-inflammatory herbs, which will help reduce the inflammation around that time of the month. So things like turmeric can help to reduce inflammation. And then there's an anti-inflammatory enzyme by the name of bromelain, which can also be very effective at reducing inflammation, reducing swelling, and helping to alleviate the discomfort of endometriosis. In addition to that, you want to balance out your hormones. So there's a couple of herbs to look into. Vitex or chasteberry can be very effective at balancing out the hormones. It actually works at the level of the brain managing hormones called your FSH and LH, which ultimately control your estrogen, progesterone, and testosterone. So I find Vitex very, very effective in endometriosis cases. And then there's a classic herb, Viburnum opulus, sometimes known as, of course, cramp bark, and you can see how that can be beneficial. It helps alleviate menstrual cramping and extreme menstrual cramping, and it's more just something to help manage your symptoms while you treat your endometriosis and make your system healthier. So I hope some of these tips will help you manage endometriosis, or even better, help prevent it if you're an at-risk individual. So I hope these recommendations will help you manage your endometriosis, or even better, prevent it. Please share this video with anyone who you think might get some benefit from it, either someone with the condition or somebody at risk for the condition. Any questions or comments, please post them below. Remember to subscribe to our YouTube channel, and as always, knowledge is health.